In tonight's WGN Investigates, the cost of Just In Case. We have reported on the $3.8 billion the state has spent to battle COVID-19.
And tonight we have the story of how a slice of that spending benefited a developer with a colorful past. Investigative reporter Ben Bradley has the story.
A year ago, as COVID cases and hospitalizations climbed, there was fear we'd run out of room to treat the sick, as happened elsewhere. Governor Pritzker used federal money to turn McCormick Place and several suburban sites into makeshift hospitals. All but one never saw a single patient. What caught our eye was a single developer who normally would be barred from doing business with the state.
He's building the same stores that people he's competing against. We're talking about a long-term lease.
John Thomas is a developer.
Because I do real estate as well or better than anyone else in this country.
And a mole who once helped the feds build a case against Rod Blagojevich.
Every major politician in the city probably came across me at some point.
While you were wearing a wire.
That's correct.
He's also a twice convicted felon.
I'll be talking to you guys next week.
Who prosecutors say once even tried to pay his own attorney with a Babe Ruth autographed baseball. Turns out it was a forgery. Most recently, he was convicted back in 2015 of defrauding Riverdale's municipal government of more than $370,000 in the failed redevelopment of this marina. He has since followed a judge's order and repaid the money.
Did you take the money, the TIF money, and use it for other purposes?
I think a lot of this. No. I think I'm portrayed inappropriately.
They call you a con man.
They call me a con man. But how many con men come out of prison with $20 and rebuild their whole lives in 3 years?
Rebuilding his life.
We have a couple other ideas. We'll see how they work.
And his real estate portfolio, which includes a new chain of supermarkets in underserved areas. And the former Sherman Hospital in Elgin, which he bought for just under $1 million in late 2019.
My partner said I was crazy.
Crazy because the hospital had sat empty for years.
But all of a sudden, a month later, COVID hits. So I cold called the Illinois state government and asked them would they be interested in renting the hospital for a COVID hospital.
With the pandemic raging, there was fear of a hospital bed shortage.
That is why we are building up the necessary hospital capacity and alternate care facilities as much as we can muster.
Pritzker's plan called for up to 3,000 beds at McCormick Place.
Nothing like this has ever been done before.
Plus hundreds of additional beds at former hospitals in Blue Island, Melrose Park, and after Thomas's cold call to the state, his shuttered hospital in Elgin. In all, taxpayers shelled out more than $115 million to build out the 4 facilities. McCormick Place saw fewer than 40 patients.
Time is driving everybody here.
No one was treated at any of the makeshift suburban hospitals.
We still have responsibilities, even in the worst of situations.
Republican House Minority Leader Jim Durkin says the state needed to prepare for the worst, but even in the heat of the moment, the governor's spending should have been scrutinized, along with the people cashing in.
Why are we doing business with people like John Thomas?
The state's procurement code specifically states no person or business convicted of a felony shall do business with the state of Illinois or any state agency.
The fact that he is going to benefit greatly off the state of Illinois for a hospital that wasn't used, it's really disappointing.
For his part, Thomas says he never hid his background, believing state officials knew who he was and what he had done.
I'm a felon who doesn't mind being a felon. It doesn't define me as a person.
In an unusual move, Governor Pritzker used the state's emergency powers to essentially take over the property. Taxpayers didn't buy the Elgin Hospital site, but rather leased it from Thomas's companies.
They paid us $4 million.
That's $4 million determined by a judge only to rent the space. The state has since vacated the property and turned it back over to Thomas.
You can't put the toothpaste back in the tube, but we have to be able to call out faults within government, because if we don't, we're going to repeat the same problem down the road.
For Thomas, his bet paid off. he made 4 times his purchase price and is now free to sell or lease the property renovated at taxpayers' expense.
I mean, why would you put $20 million into a facility and not use it for something?
You want to go this one?
And though it benefited him financially, he believes the state erred by not using its investment in the hospital to offer low-income residents, particularly blacks and Latinos who have been disproportionately affected by COVID, equitable access to health care long after the pandemic is behind us.
Well, Command Center was here when they first started laying out plans.
Thomas recently gave us an exclusive look inside
If you scrapped everything in this building and sold it for scrap, you'd make a few $1 million.
at the renovated rooms.
I only have a few regrets in my life. This is not one of them. They actually were going to build down here, and they stopped. It's like they just threw everything everywhere.
And everything else the state left behind.
$100,000 of curtains, which is just amazing. You know, if I were the state, I would have kept it as a hospital. You had it already. You put the money in. Why walk away?
A spokesperson for the governor points out it was federal, not state money that paid for these makeshift hospitals, but it all comes from the same place, you and me. As for doing business with John Thomas, the governor's office says under the disaster proclamation, procurement rules were suspended, meaning in this one case, doing business with a convicted felon is just fine. Ben Bradley, WGN Investigates.
More rains on the way for tomorrow. Tom Skilling's tracking the system. Your full forecast less than 10 minutes away.
Also ahead for you, will President